There's a nutrient that most doctors never test for, and many people may not have heard of. But the research suggests that it could reduce your risk of dying from cardiovascular disease by 57%. This is not a drug or a new discovery, it's a vitamin, and there's a very good chance you're not getting enough of it. It's called vitamin K2, and it does something genuinely remarkable. It acts like a traffic director for calcium in your body. When it's working properly, calcium goes where it belongs, into your bones and teeth, and when it's not working, that calcium can end up somewhere far more dangerous, like in your arteries. I'm Michael Smith, and I'm a naturopathic doctor, and K2 is a supplement that I personally take every day. Not because I sell it, but because of my own cardiovascular history. And I'll tell you a little bit more about that later when we get into the heart section. In this video, I'm going to cover everything you need to know about K2, what it does in the body, the difference between K1 and K2, and why the form matters, plus the research on heart health, bone health, brain health, food sources, dosing, and who needs it the most, and how to check your levels. Most people assume that vitamin K is a single nutrient. It's not. There's K1 and K2, and they're chemically related, but they do fundamentally different things in the body. Having enough of one tells you absolutely nothing about whether you have enough of the other. Vitamin K1, technically called 𝗪𝗿Ｈİ𝗶, lives in green leafy vegetables like kale, spinach, broccoli, parsley, and its primary job is blood clotting. It activates proteins in the liver that control whether your blood clots properly or not. And this is actually why patients on blood thinners like warfarin have to watch their vitamin K1 intake. Most people who eat vegetables get reasonable levels of K1, and severe K1 deficiency causing bleeding problems is quite rare. Vitamin K2 is the mineralise is a different story altogether. K2 doesn't live in your green vegetables, it lives in fermented foods and animal products. Things like natto, aged fermented cheeses, grass-fed butter, egg yolks, and liver. And K2's primary job has almost nothing to do with blood clotting. K2's job is to activate proteins that manage where calcium goes in the body, directly into the bone, the teeth, and preventing it from being deposited in your arteries. But standard blood tests don't measure K2 at all, so most people don't know whether they're deficient or not. And we'll come back to testing at the end. To understand why K2 matters, you need to understand the two proteins it activates. The first protein is called osteocalcin. I'll call it the bone anchor. It's produced by your bone-building cells, and its job is to capture calcium from your bloodstream and put it into the bone, bind it into the bone tissue. Think of it as like a net that catches calcium and locks it into the bone. And here's the critical part. Osteocalcin only works when it's being activated by vitamin K2. The second protein is called Matrix GLA Protein. I'll call it the arterial guard because that's exactly what it does. It guards your artery walls against calcium deposits. Your arteries are lined with smooth muscles that produce this protein. When it's activated by K2, it increases a chemical barrier that prevents calcium crystallizing and getting deposited in the arterial walls. When it's not activated, that barrier is down and calcium can accumulate freely, and this is what leads to arterial sclerosis or hardening of the arteries. It was once thought to be an inevitable part of aging, but we know it's upregulated by a process called the GLA protein, and this was once thought to be an inevitable part of aging. We now know it's actively regulated by a process, and this Matrix GLA protein is one of the primary regulators. I covered calcium and bone health in an in-depth video recently, so I won't go into that in great detail. But K2's role in bone health is worth understanding clearly, because the two nutrients work together. You can take all of the calcium you want, you can have adequate vitamin D so the calcium absorbs properly from your gut, but if K2 is low, the bone anchor protein stays inactive. The calcium has nowhere to bind to. It circulates and significant amounts end up in your soft tissue rather than the bone. The research on K2 and bone density is very strong, particularly from Japan, where a high-dose form of K2 is actually prescribed as a pharmaceutical drug for osteoporosis. And multiple trials have shown it significantly reduces fracture risk. And some of you might know from my previous videos that I've had my own cardiovascular issues, atherosclerosis. And that's something I monitor regularly. And when I started going deeper into the research on K2, it stood out that this was one thing that was missing from my diet, and I just wasn't getting enough in supplements, which is why I added in a K2 supplement daily. And I recommend K2 to any of my clients with a greater cardiovascular risk. So let's look at the research. In 2004, a large Dutch study published findings that generally changed the way researchers think about K2 and heart disease. Among 4,800 participants followed for 10 years, those with the highest intake of vitamin K2 had a 50% lower risk of dying from cardiovascular disease compared to those with the lowest intake. They also had a 52% less severe aortic calcification, and here's what made this study particularly significant. K1, the form in leafy green vegetables, showed no meaningful cardiovascular benefit. Only K2 did. What this study confirmed is exactly what we covered in the previous section. The arterial guard protein requires K2 to do its job. When K2 is low, that protection breaks down and calcium can start to deposit in the arterial walls. More recently, a well-designed randomized trial gave women 180 grams of MK7 per day for 3 years, or a placebo. And the group taking the K2 showed a significant reduction in arterial stiffness, and the stiffer arteries indicates more cardiac workload is higher, blood pressure is higher, and a greater risk of heart disease. Vitamin D significantly increases the amount of calcium your gut absorbs. It also increases the production of both proteins we discussed, the bone anchor and the arterial guard. Both of those proteins require K2 to become active. So here's what can happen. You take vitamin D, your bone absorbs more calcium, and this produces more of these proteins. But if K2 is low, both proteins remain inactive. The newly absorbed calcium has no guidance system, and it can end up circulating, potentially depositing in the soft tissues. This is one reason why some large-scale vitamin D trials have produced disappointing results with cardiovascular outcomes. The K2 status of the participants wasn't controlled for. The practical message, if you're taking vitamin D, especially at higher doses like anything above 2000 IU daily, K2 should be part of your supplement regime. And many good quality supplements now combine vitamin D with K2. There's also a third nutrient in this group, it's magnesium. You need magnesium to help convert vitamin D to its active form. So this is an area of research that has really developed in the last 15 years or so, and it's changed how we understand vitamin K2's role in the body. It turns out that osteocalcin, the bone anchor protein, doesn't just anchor calcium into the bone. When it's fully activated by K2, it also travels to other organs and acts almost like a hormone. Specifically, activated osteocalcin stimulates the pancreas to produce more insulin, and it increases the sensitivity of the cells to insulin, meaning it helps your body use insulin effectively. In animal studies, when osteocalcin function is removed, the animals develop something closely resembling type 2 diabetes, and restoring osteocalcin function reversed these changes. For women with PCOS, or polycystic ovarian syndrome, this is particularly relevant. PCOS is fundamentally driven by insulin resistance, and K2 status tends to be lower in women with PCOS, and is generally an underutilized part of management of PCOS. So with the diabetes and insulin resistance, a lot of this is animal studies, it's still getting researched, and it's not as solid as the heart and bone density research on K2. But the mechanism's solid, and there's no downside considering how safe K2 is to add this into your regime. MK4, the short chain form of K2, is uniquely concentrated in the brain. It's the predominant form of K2 found in brain tissue, particularly in the myelin sheaths that insulate nerve fibers. MK4 is involved in the production of a class of fat molecules that are key structural components of the myelin sheath. Low MK4 may impair myelin integrity, which is not just relevant for brain health, but potentially for things like peripheral nerve function. There's also a K2-dependent protein that has neuroprotective effects in the brain. And in several observational studies, lower K2 status is linked to a higher risk of cognitive decline. The brain health evidence for K2 is promising, but it's not still at the same research as the cardiovascular and bone evidence. But if you're already taking K2 for bone and heart health, there's no reason why you don't want to protect your neurological health too. And while researching vitamin K2 for this video, I found a piece of history that I found genuinely fascinating, because it shows that K2 isn't really a new discovery, it's a rediscovery. In the 1930s, a Canadian dentist named Dr. Weston Price spent a decade traveling the world studying traditional populations. People who had no access to modern dentistry, no fluoride, no dental care, yet had virtually no tooth decay. Beautiful jaw structure, and he identified a fat-soluble compound in their diets found in grass-fed dairy, organ meats, and fermented foods that he believed was responsible. He called it Activator X because he couldn't identify chemically what it actually was. Decades later, researcher Dr. Chris Masterjohn identified Activator X as vitamin K2. And the point isn't just historical interest, it's that traditional diets, which included grass-fed animal products, fermented foods, and were naturally rich in K2, while modern Western diets, low-fat, grain-fed, not much fermented products, have largely removed K2 from our diets. So we didn't create a new deficiency, we removed something that was already there in the first place. For most people, the MK7 form of K2 at 100 to 200 micrograms a day is the best place to start. It's well studied, practical, and has a once daily dosing regime. If you have specific brain health concerns, MK4 may be worth adding. And because MK7 doesn't cross the blood-brain barrier as well. Some quality supplements now combine both forms, which gives you the best of both worlds. MK7 for systemic, cardiovascular, and bone support, MK4 for the neurological health. And natto is by far the richest source of MK7 in the body, up to 1,100 micrograms per 100 grams. It's a fermented soybean product eaten regularly in Japan. Western palates can find natto challenging, especially on first encounter. It's quite the strong sense of taste and smell. Otherwise, you can get it from aged fermented cheeses, and the best options things like Gouda and Brie, which have around 75 micrograms per 100 grams, significantly less than natto. Regular cheeses, processed cheeses have minimal K2. For MK4, grass-fed butter and ghee are the best sources, and grass-fed's the distinction here, because K2 comes from the animal converting the K1 in grass into K2. And so grain-fed animal products produce dramatically less MK4. Egg yolks from pasture-raised chickens, liver, and organ meats also have K2. Certain groups are significantly at risk of a K2 deficiency. Anyone taking vitamin D supplements, especially at higher doses, they have an increased need for vitamin K2 because vitamin D upregulates the proteins that vitamin K2 needs to activate. People eating low-fat diets essentially eliminate most K2. Anyone who's a vegetarian or vegan, unless you're eating natto, you're probably not getting enough vitamin K2. Also, anyone with fat malabsorption, because K2 is a fat-soluble vitamin. So things like Crohn's disease, celiac disease, anyone who's had their gallbladder removed may have trouble absorbing vitamin K2 efficiently. Anyone with cardiovascular disease or known arterial calcification or osteoporosis, these conditions precisely are linked to vitamin K2 deficiency, so you want to start taking it regularly. And older adults generally because of poor absorption as we get older. So that covers a lot of people that probably should take vitamin K2. But before I give you the dosing guidance, here's an important safety note. If you're taking warfarin or a similar anticoagulant, don't start taking vitamin K2 without your doctor's approval. They both work on the same pathway that leads to blood thinning. And that's not something you want to navigate on your own. So talk to your doctor first. Many of the newer blood thinners work differently and are not affected the same way of K2 supplements, but still talk to your doctor. For everyone else, vitamin K2 has an excellent safety profile. There's no established upper limit because toxicity has not been demonstrated, even at higher levels. For general health maintenance, MK7 at 100 to 200 micrograms a day is the most evidence-backed dosage. Take it once a day with your largest meal, ideally containing a little bit of fat at the same time to improve absorption. And if you want to add MK4, look for one of the combination products that have MK4 and MK7 in the same product. Standard blood tests don't measure K2. Your GP's routine panel will tell you nothing about whether your cardiovascular protection is adequate. In clinic, I use the Vibrant Wellness Nutrient Zoomer to assess both K1 and K2 levels. I'll leave a link in the description about the Neural Zoomer panel. This test covers K1 and K2 and all of the other vitamins and minerals. So it's a very detailed and comprehensive test. And if you can't do the testing, this is what I would focus on. Step 1, look at your diet. Are you eating grass-fed animal products, pasture-raised eggs, aged fermented cheeses or natto? If so, you may be getting enough K2 naturally. If you're eating a low-fat or a plant-based diet, you're almost certainly not. Step 2, if you're taking vitamin D, make sure you add in some K2 as well. Step 3, if you have cardiovascular disease, osteoporosis, or a history of cardiovascular disease in your family, you may want to add K2 as well. It addresses the specific mechanism that most standard treatments don't touch, and the evidence is really solid. Step 4, if you actually want to test your levels, use the neural zoomer panel in the description below. K2 is one of those nutrients where the research is genuinely compelling, the safety is excellent, and the cost is low. The reason it doesn't get more attention isn't because the evidence isn't there, it's because it doesn't fit neatly into a drug model. Drug company can't make money out of vitamin K2 supplements. But for me personally and many of my clients, it's become part of our standard supplement routine. If you found this video useful, check out the calcium video next, which goes into more detail about K2 and calcium connection. If you have any questions or comments, please leave them below. Or if you have a personal experience about K2, I'd be happy to hear it.